So that visit with Megan Cates was August the 19th, 2014, where I recorded her having me sign releases that apparently she never sent for Boone's records or Rainbow Pediatrics records in Arizona. I don't know yet if she sent for university, but it's a university affiliate. And I recorded South Providence, Green Meadows clinic manager stating that they're sister clinics. Whatever treatment you get at one, you're going to get at the other. And that's exactly what happened. The discrimination and the abuses that happened at Green Meadows, which is now South Providence, was ultimately picked up and tried to be covered up at Family Health Center. Meanwhile, I'm still bleeding. I'm crippled. I'm unable to go to work. She prescribed the narcotic Ultram, which she gave me like 60 pills or something like that. I'm working with Nanette Ward from the Central Missouri Stop Human Trafficking Coalition and Catherine Hart. I'm trying to find housing. They got me off the street because I inadvertently took the confession of a Democratic candidate who was apparently selling narcotics to street traffickers. She had to get me off the street for my safety. So Nanette escorts me into the follow-up appointment with Dr. Cates on September 3rd of 2014. I had had a bad fall. She did a very painful exam of the knee where there's titanium. I said, I need a referral to a GYN. This bleeding isn't stopping. Nothing's stopping it. I'm bleeding. I have all this pain in my crotch. Down the front of the legs, like the inner thigh. Up under the butt. It's in the back. Still doesn't lift up my shirt to see if there's any swelling back there or nothing. Well, I'm worried about your mood, she says. I said, my mood is contingent on this pain and this bleeding. Get me to an OBGYN. Get me an ultrasound. I can get some answers and get some proper treatment, and the autism aggravation will improve. It's not a mood disorder. It's called autism spectrum disorder. And it's about sensory overload. And we really don't like not knowing, when we have all this pain that is really, we have a sort of a attention deficit disorder anyway, especially as a savant, because any little thing can trigger up all these memories so we can make sense of whatever the stimulation is. When you have all this crippling pain and bleeding, then you have, all kinds of issues. It's going to aggravate the autism. And also I've learned that autism makes us feel the pain a whole lot worse than it does other people. We don't have this wonderful abundance of natural opioids that neurotypical people do to sedate us. We don't have that. So she documented that she referred me to a psychiatrist. The audio recording doesn't reflect that. It reflects me asking for, once we get the bleeding and find out what's causing all this pelvic pain and fever, then we'll deal with, other issues, but let's get the bleeding dealt with first. She writes for a refill for $280 or something like that of the Ultram, of the Tramadol, the narcotic. Documents things. I didn't know this at the time. Whenever she leaves the room to go get the prescription, Nanette says, Heather, you're being awfully nice to her. I said, you see what happens when I try to correct her and get her right on the right path. She gets nasty and abrasive. I said, I can't really make too much of a ruckus because I can tell by their attitude, and I know by having interviewed other Family Health Center patients, if you don't knuckle under and let them do that, manipulative, fraudulent sort of thing, they will discharge you as a patient. The retaliation is fierce, and I actually got it in writing from Gloria Kroll. It's called gaslighting. They put it all off on you, falsify the medical records to make it look like you were being uncooperative, and then say you discontinued care, whatever they write. And I have them on audio doing that. So I didn't make waves. I was bleeding too bad and in way too much pain. And I really needed, not knowing that they had an OBGYN named Dr. Elizabeth Wilson that was volunteering right there at Family Health Center from Women's Health Associates over at Boone. She could have referred me the first visit. Uncontrolled bleeding, she could have got the one phone call. Boone Hospital said she could have picked up the phone and got that ultrasound that showed that tumor. One phone call, because it's continuity of care. She didn't need me to sign a result. What I didn't know was she had no intentions of sending for that ultrasound. So Nanette and I talk about it, and it's clearly this child is, I call it the she-child non-prodigy. That's why Nanette wanted to go in there and see it for herself. Nanette was a former human rights investigator with the local Human Rights Commission. And what she witnessed was the discrimination in the provision of healthcare services. She wanted me to go participate in this psychiatric kickbacks thing with these other doctors and not deal with the issue that I really needed help with. After I explained to her I was autistic, I'm clearly well-spoken. And when somebody's bleeding and losing their job, what this kid wrote was, she just made stuff up that didn't happen, documented it, and then diagnosed me as schizophrenic. She documented that I had asked for an OBGYN. She did not document that she refused to send for Boone's ultrasound. So Nanette and I are at the pharmacy, and Nanette said this was very irresponsible of her not to deal with, because we still aren't getting an answer on the bleeding. Never mind, I was seen at Boone Hospital Center. This particular Dr. Cates appointment was September 3rd, 2014. My first visit with her was August 19th of 2014. That ultrasound showed that tumor July 17th of 2014. So we're talking just a month's time. Had she sent for that ultrasound, got me in to see Dr. Elizabeth Wilson, got me into a 10-minute myomectomy, I'd have been back to work, boom, boom. No more needing of narcotics. Everything would have, no more bleeding, no more hemorrhaging, no more problems. But they weren't going to do that. They were bound and determined to force me into this kickbacks fraud stuff. So Nanette and I discussed it, and Catherine Hart, who was with Rescue Innocence at the time, she says, I'm going to put in a call to a lady named Beth Sweeney. She says she treats one of my other clients. She's really nice, really awesome. I think you would really like her. And I think that she'll sit down with you and really go over this. I can't wait to tell you about this. So basically, I got another referral to get the hemorrhaging got worse. And it was hemorrhaging. We know that now. They weren't documenting as such, but ultimately we now know that level of blood loss, as many pads as I was going through, is way exceeded what you'd normally call heavy bleeding. So stop here.